Being a GP is all about making that human connection with somebody and really understanding what it's like to be in their shoes and living their life. Hi, good morning.
You're sharing moments in patients' lives that are very personal. And for someone to share those moments with, you might be a complete stranger to them or a friend that has formed over many years, is a priceless honour.
Mobile surgery?
If it's itchy, it could be a number of things. Could be a number of things.
Like what?
Some form of dermatitis.
Don't know what that is.
No.
Hello.
Hello.
Hello, Leighton.
Yes.
Come on in.
Thank you. I'll do. Thank you.
And you must be Mum?
I am Mum. Yeah.
Great.
Nice to meet you.
What was your name?
Natalie.
Hi, Natalie. What can we do for you today?
So Leighton, last week or so, has come up in like 3 or 4 hives on his back.
Okay.
They're like little blisters. He's saying they're extremely itchy.
Okay.
And then he's got a few on his chest in a line here as well. You're just really itchy though, aren't you?
Yeah.
Yeah?
Yeah.
Like, so bad that it's like keeping you up at night?
Not that bad.
Okay.
But if one's itching, I'm gonna itch the other, then the other one's itching, then the other, and then...
Have you ever had anything like this on your skin before?
No.
No. Great, well, it's going to be easiest if you just show me.
Yeah.
All right. Just,
Take your blazer off. And then we'll work around your shirt.
yeah.
Lift it up. It'll probably be easier.
All right, that's okay. Right, yeah, so we've got this little group in here, we've got this little group in here.
I think there was that little one.
There's a little one there,
And
yeah.
he's got the different ones on his chest.
Can I see it round on your front as well, please, mate?
Yeah. Just lift it up at the front light and do the same. So you've got this here.
Yeah.
And then you've got your cluster there, haven't you?
Yeah?
Yeah.
Okay. Great, okay. Straightforward, simple enough diagnosis. You've got a condition called shingles.
Oh, really?
Yeah. So shingles is the same virus that causes chickenpox. But once you've had chickenpox once, you can never catch it again. But what you can have is a reactivation of the virus, which is what causes shingles. And basically, when you get shingles, it causes a rash, which basically looks like the one you've got. But it always happens in one particular strip of skin. And it's a strip of skin that usually wraps around one side of your body. And that's how we know it's shingles, because it's always just on one side of the body and never spreads to the other side.
I thought shingles initially, but when I did the research, it said about a lot like headache, pain, sickness, feeling, and fevers. He's had none.
Exactly, so it affects different people in different ways. The people who get more unwell with it tend to be older, tend to have other medical conditions. So Leighton being a young, fit, healthy 12-year-old, obviously not too badly affected by it. The thing about shingles, it actually gets better on its own. Yeah. Usually, if you're going to give any treatment for it in terms of like that's going to make any benefit, usually you want to start it within the 5 days. So I don't think we necessarily need to give Leighton any pills or anything. There is a cream he can use if he really wants to put something on it, which might help reduce the itching and discomfort. And yeah, you're basically just going to watch it heal over the next sort of 7 to 14 days.
Try not to itch him too much. Now you started.
Yeah, now once you start, you can't stop. So importantly, you want to try to avoid scratching. Because if you do damage to skin, then it's more likely to leave a little bit of a mark or scar.
Scarring, yeah. Leave him alone.
Can't stop.
Great. Do you know which pharmacy you normally use?
This one here, yeah.
So it should go straight there. So you can go pick that up now.
Excellent.
And all should be well. All right.
Super. Yeah, lovely. Thank you very much. What you say?
Thank you.
Thank you. Take care.
Thank you.
Come on, Pop. Thank you very much.
Bye-bye.
Bye. Take care.
Hello.
Hello.
How are you?
I'm fine, thank you.
Is it Hannah?
Yeah.
Brilliant. Here to see Dr. Kara. If you just want to take a seat there, she'll be out in a minute.
Hello, Hannah. Do you want to come in?
Yeah.
Right, do come in. Do you want to take a seat there?
Yeah.
Right. Thank you for coming. So I'm Dr. Carer. So what were you hoping we could do for you today?
I've been getting a bit of a problem with my left boob. At night it becomes very purple, it hurts all the time. But I'm feeling really like exhausted, quite faint. I don't know if it's connected. That's why I've come to the doctors.
Right. So when did you first notice the change in colour?
I actually noticed it only yesterday.
Have you noticed any lump with this discoloration?
No, not that I'm aware of. It's very sore, very tender.
Right. Have you had anything like this before?
No.
And have you noticed any boil or abscess there? Okay. And any family history of breast problems at all? Breast lumps?
No.
Breast cancer? Nothing. Have you noticed any other symptoms at all? Any waterwork symptoms? Or...
Oh, yeah. Now you've come to mention it.
Do you have any urinary symptoms?
I'll get a sudden urge, and when I get a sudden urge, I'll
You have to go immediately.
Yeah.
Orange.
Going all the time, all the time.
I do think we still need to get a urine test done today.
Yeah, it's a bit cloudy, isn't it?
So let me have a check of your urine. We'll see what we can find.
There's no glucose in the sample, there's no signs of infection.
Okay, good.
Yeah, it's going more purple as I leave it there, so you do need some antibiotics for a urine infection.
It is coming up with every colour of the rainbow.
And let's get that urine tested.
I'm having a few problems with weeing and stuff.
And is it cloudy or offensive?
It's not a very nice smell.
And are you more thirsty than normal?
Yeah.
It sounds though you might have infection, so we'll have a look.
Yeah.
But sometimes people can be more prone to infections if they have diabetes.
Right, okay.
You are at increased risk of diabetes and you're giving some of the potential symptoms.
Yeah.
So it would be sensible to just do a blood test to check.
Yeah.
It may be sensible to just bring a urine specimen in on the day that you also have the blood test.
Yeah.
So we can check that as well.
Okay.
In terms of the breast, what I'd like to do is pop you on the couch
Yeah.
and if I can get you to take your top things off,
Yeah.
we'll have a look and then I'll have a feel of the breast. Okay. Right, so, and if I could just get you to lie down here with your head on that end. So, where did you notice this discoloration?
All around there.
Okay, so just underneath the breast. Okay, no pain at all in the breast?
Oh no, nothing in this one.
Okay, so just having a look. So is this the area that you noticed?
Yeah.
Okay. Have you had any discharge from the nipples at all?
A little bit.
What colour has it been?
Like a yellow.
And particularly this one?
Yeah.
Okay, can't see any discharge here at all at the moment.
Yeah.
And this area that you noticed the discoloration is actually looking quite normal at the moment, which is good.
Yeah.
Okay, do you want to get dressed?
Yeah.
So I'll just pop back once I've washed my hands.
Okay.
Just looking at the breast, they both look normal.
Yeah.
There's no discoloration of the skin at the moment. I can see where you were describing, but it actually looks okay. There's no signs of any infection in the breast itself. And I couldn't see any discharge from the nipple either. There's also no lump there. So all of that's actually quite reassuring. So plan is we'll get some bloods done to check you for diabetes. So we'll do that this week. So if you just speak to the girls at the desk for that. And then just today, for my peace of mind, we'll just get your blood sugar and ketones checked. And if that's all okay, then we just watch and wait. If anything changes, so you feel any worse, then you know to come back and see us.
Okay, thank you.
Good.
Thank you.
You're welcome.
Thank you.
Thank you.
Enjoy your day.
welcome to the mobile surgery.
Hi.
Hi. I believe you're here to see Dr. Hyder, is that correct?
I think so, yeah.
Brilliant. If you'd like to just take a seat.
So when they do this in here rather than in the actual surgery?
So it's a mobile surgery, so we're travelling around, which is quite cool.
Hello there. Come through and have a seat. It's Dr. Hyder. And how are you?
I'm okay. I'm in a lot of pain though at the moment. So I've been having problems with a lump in my back. Probably for about a year or so.
Okay.
I had a scan last week, an ultrasound scan. They said it was a tumour in there. The pain's a lot worse, and it's just, it's really affecting me now.
Okay.
It's starting to affect everything now. I'm not sleeping, I'm not doing so great at work.
I mean, you're looking quite tearful.
Yeah.
Yeah. You haven't actually seen anyone, have you, since you had the report?
Not since
Shall I
I
go
had the
through that
scan.
with you so you can see it yourself? I know you've had the pain for a long time, but to hear that they found this, what they called an intramuscular tumour, yeah, was that a real shock, or did you think something was going on?
I knew something was wrong, and I've known I can feel that lump.
Yeah.
And it's been quite frustrating actually, because it's taken so long just to get the ultrasound scan.
Right.
And it has felt like, it's kind of, I know GPs see a lot of back pain, I get that, but it's not muscular, and it's almost like trying to convince people that there is something wrong and it needs to be looked at.
So it's a tumour within the muscle, and they've said there's no aggressive features, so they don't think that this is something that's going to spread or that can spread. Can I ask you a little bit more about the type of pain you're getting with it?
Yeah, sure.
Does it feel like it's a constant ache?
It feels like there's a hole in my back.
Okay.
That every now and then there's a small creature in there burrowing away.
like a
And except now it's kind of
gnawing
burning
pain.
as well. So
Burning
it's-
as well. Does it radiate to anywhere?
So when it started, it was kind of contained in a smaller area, but now it feels like it has spread out.
Okay. Do you ever get any numbness, tingling in your legs or your arms?
Not really, no.
Or like sharp shooting pain?
Every now and then, yeah.
Okay. We do need the MRI scan to see further details of how large it is and what it's pressing on, the soft tissues. And in the meantime, we need to get you some better pain relief, don't we, if you're struggling like this? Intramuscular tumours are very rare, and in Amy's case, this is the first time I've seen one like this. Not all tumours are cancerous, often they are benign, but this will need some further investigating with an MRI scan and an urgent referral to see the specialist to find out exactly why this is there and to make sure it isn't something more sinister. So the things that you can be taking altogether are ibuprofen with food, the paracetamol,
And the
to do that, and the ibuprofen, yeah. And then you can continue the gabapentin as well.
Okay. Okay, that's great, thank you.
Take care.
Hello.
Hello.
Hi, welcome to the mobile surgery. How are you?
Well, I'm all right, apart from me cough and that.
Oh no, bless you. I believe you're here to see Dr. Rafi.
Yes.
Excellent. If you'd like to just take a seat.
Thank you. What if I keep on like this? The neighbours will be complaining.
Oh no.
Hello, lovely.
Thank you.
Come on in.
Thank you very much.
Come and take a seat.
Thank
My
you.
name is Dr. Rafi.
Right.
Thank you for waiting for me.
Oh, you're welcome.
Right, how can we help today? What's going on?
Well, the cough that I've got, this is the 5th week now. I either cough for a bit and then stop, or then I go on, and it just feels like I'm going to choke.
Is this the sound of the cough throughout? So, in the sense, to me, that sounds a little bit wet, but mainly dry cough.
Yeah.
You know, are you bringing stuff up with it?
I am, but not as much as I would expect to.
And is it clear, mainly?
It is mainly clear, yes.
All righty.
Yeah.
And is there anything else that sort of triggers off the cough?
I have noticed that when I'm doing anything, I'm getting out of breath more, because I've never suffered with breathlessness.
You're not?
No.
And as well as the cough, you feel like you're getting more breathless?
Yes, yeah, I do, yeah.
All righty.
Yeah.
Have you noticed any swelling anywhere? So swelling of your legs and ankles in particular, I'm thinking of.
No.
No, you've not noticed anything
No.
like that? Okay. Okay, doc. So I just need to examine you if that's okay. Are you comfortable there? Yeah,
Yeah, fine,
All
yes.
I'm just going to have a listen at the front first, and we'll have a
Okay.
listen at the back.
Right.
Okay, and then just lean forward slightly for me. Look straight up. That's it. Deep breath. And out. Just pop your finger in there for me and just relax your hand in your lap. Okie dokie. So, you see that number there?
Yes.
The 90, that's your oxygen levels.
Right.
Now, we'd expect that, as a general rule, to be 93% and above. It's in a percentage. You're not getting enough oxygen around.
All right.
And that's quite often what's triggering the cough.
Mm-hmm.
So when your oxygen levels drop or when your airways get tight, then your body's making you cough to try and open those airways up again. Does that make sense?
Yes.
So what I'm going to ask my colleague for is to get us some oxygen to see whether we can bring that back up.
Right.
And then we can talk a little bit further about what we're going to do next.
Okay.
Does that sound okay?
Yeah, that's fine.
All right.
Yeah.
It's lovely to see you.
Thank you.
Great.
Nice to see you too.
Thank you.
Right, what can we do for you today?
I had problems walking, and I intended to, from walking
All over the place.
all over the place. That's
Okay,
right.
okay. Now, when you have tended to feel unsteady, has it occurred after doing any exertion, like sort of going up the stairs?
It's there all the time.
Okay, okay. Would you mind if I checked your blood pressure? If you just take your cardigan off. So if I'm just going to rest your arm down on it there. That's great. So this is okay. It's a little bit higher than normal for you, but I know we've got some normal readings quite recently. Okay. And the other thing I want to do is just check your pulse. So very occasionally we can have slightly irregular heart rhythms that can then make us more prone to falling.
The only problem I've got is my legs at the moment.
Let's get you onto there. It's a bit high, I'm afraid, so I can go and get a step. Would that help? Right. So let's swing you around if we can. Is that upright enough for you?
I'm okay.
Right.
Thank you.
Okay. So can you bend this leg for me? Now pull me towards you. So bend the leg down and pull your heel in towards your bottom. Okay, and now push my hand away. Okay, that's pretty strong. Now same again, pull my hand in towards you. So it's still pretty strong, but there's a slight difference between the two sides.
Correct, yes.
Okay, let's just give you a hand getting off this. Oh, we've got you all twisted. There we go. Okay, let's go, and there's a little jump. Just like to see you, I know it's not a very big room, but just see you walking. So if I could perhaps get you to walk towards the plant. So just as you normally would, okay. And then if I could just see you turn and walk back. Okay, so you're not veering to either side at all doing that.
When I walk on the road,
You feel
I feel I'm going left and right.
both sides, okay.
Yeah.
So if I could just see you walking heel to toe as best you can. Okay. So that you're finding a bit more difficult. Okay,
Yeah.
that's fine. Okay.
Yeah.
Right. Yes, you're not great walking heel to toe.
No, I'm not.
Yeah.
I do know that.
Yeah. I think some of this may be left over from the stroke that you had on that side. Falls are really common in the elderly. As patients get frailer, you often see that their muscle power goes. If they've had a history of stroke like Joseph had, then you often see an imbalance on the two sides, which can make them more prone to falls. And then, of course, as their senses change, so in other words, their vision, their hearing can impact on mobility and falls risk. And our job is to try and work out which of those might be impacting that patient. What I've got in mind is a referral to something called the Falls Clinic. And that is run by our elderly care consultants who look to see what could be the underlying reason for why this is happening. So if you're happy with that, I'll go ahead and make that referral.
Very, very good. Thank you.
There we go.
Thank you very much.
Very nice to see you.
Lady. Again, thank you. Thank you for your help.
Thank you. Enjoy your afternoon.
Okie dokie. Now we should see those numbers to slowly start creeping up, and you might feel a bit of relief with your breathing and your cough. You okay? Shaking a little bit there.
No, fine.
Okay. So something is not allowing the air to move around properly in your lungs. That's where this cough is coming from.
Yeah.
There you go. Look, 96%.
Yeah.
We've not managed to get to 96 before, so that's a positive in itself.
Yeah.
All right. So the most common thing is infection.
Yeah.
So what happens with infection? You get lots of gunk on your chest. It blocks up the airways, and that stops the oxygen moving around as it should. Okay, good. And your breathing's a bit more settled now.
Yeah.
Certainly from when you came in. The other thing that can cause some restriction to your breathing is if you get fluid on the lungs. Where can that fluid come from? It can sometimes come from your heart, if your heart's not pumping the blood around properly. Yeah? And the reason I'm telling you all of these things is because it's not crystal clear what is going on with his chest. So we need to investigate this a little bit further, I'm afraid. Yeah?
Yeah.
I'm hoping that you don't have to stay in.
Right.
But we do need to get you into hospital
Okay.
today.
Today?
Yeah. And actually, because you're needing this, I'm going to have to get an ambulance to take you there.
Oh dear.
How do you feel about me saying that?
Oh, if it's got to be done, it's got to be done.
Morning.
Good
What's
morning.
your name, lovely?
Barbara.
Barbara.
Yep.
Let's have a little feel of your wrist.
My name is Dr. Rafi, Dr. Hader. Mrs. King has had a cough for about 6 weeks.
Okay.
Very short breath. Then when I stuck the SATS monitor on it was dropping down to 89. My main concerns with Barbara were her unexplained, really, breathlessness and low blood oxygen levels. Not having any known underlying lung condition that could have contributed to the low blood oxygen level made me concerned.
How have you been in yourself?
I'm fine. I haven't felt ill. No, it's just been a nuisance because I've had to keep coughing.
No. Did you feel better after the nebuliser?
Yes.
I knew about her heart condition, so that contributing to her breathlessness and her low oxygen levels is a potential diagnosis, but we need other investigations to determine that, and that's best done in hospital.
We'll just hook you up to our... Try not to panic, it'll all be okay, all right? Probably something very simple fix.
Thank you.
That's okay.
Thank you very much.
Sorry for causing all the havoc.
No.
All righty.
Thank you.
Well, thank you for being an absolute star.
You're welcome.
Pick the right door.
Do you know?
Okay.
Yes, thank you.
It was a bit brighter out here, isn't it?
Are you all right sitting down, my love?
Yeah.
Have you come of your own free will, or has your wife encouraged you to come?
My wife has been cutting my hair. She's noticed a mark on the side of my head.
You're doing the injections yourself, aren't you?
Well, my wife does it. She enjoys it.
She enjoys it. Why do you think that is?
I think she likes giving me pain.
So I'm looking after my husband who's just had a full knee replacement.
Right, okay. So you got a lot.
I should have missed that out in sickness and in health. I should have missed that out.
Planned for the weekend?
I go straight to the bookies.
And then if you win, how do you celebrate?
Don't tell the wife, do you?
The wife is concerned that, you know, if it gets too bad, I won't be able to do her dinners, you see.
Okay.
Squeeze in
I have to tell
my husband he'll have to cook the dinner
Yes,
tonight.
tell him doctor's
I've
orders.
Got to rest.
Yes. Do you want me to write you a letter?
Have you got a busy afternoon then?
Might as well go for a cup of coffee with the wife somewhere, I don't know.
That sounds nice.
No, my wife's disabled. If I don't take her out, she can't get out.
Okay, that's
'Cause,
nice. And it means you get to spend time together, so that's good.
Oh, it's been 57 years now.
Oh, wonderful. You've got 57 more in you.
Oh, I don't think so.
Hello, come on in.
Been a long time.
Yes, it has.
Yeah, are you all right now?
I'm very well, thank you for asking. Do come in. How are you?
So. Suffering a bit, but...
Right. I suspect that this is about the diabetes, and I can see that you had some blood tests done in June.
Yeah.
Because I can see that your blood tests have gone up a little bit.
Is it?
Yeah, not an awful lot. You know, you were sort of really on the border before, and now it's sort of just crept into the diabetes range.
Oh, yeah.
Yeah.
I've been close for a few years, haven't I?
Yes. In terms of diet, what's that been like?
I've cut out a lot of things. My cakes and that, I've cut out totally. Potatoes once a week.
Okay. Right.
I had chips last week for the first time in a month.
That's allowed.
Hey?
That's allowed.
Oh, you tell my wife.
And how, I understand, are you the carer for your wife now?
Well, I'm not called a carer, but I look after her.
Okay.
I married her and I took a vow to look after her.
Yeah.
And I have done for 57 years. So.
Right. And are you coping okay?
Yes and no. You know, sometimes I find it a bit hard. I don't tell her that. And I don't bother, just get on with it.
Yeah. And who do you have supporting you? Do you have any family?
I've got a son and a daughter, and they're brilliant.
Okay. So in terms of the diabetes, I think the only thing we need to do is recheck those bloods. If we find that it's better, then we don't do anything else. If we find it's any worse, then I might be giving you a call to increase the glucophage to twice a day. And then we'll see how you're getting on.
Yeah.
Okay. Is there anything else you wanted to talk about today?
No, I'm all right.
Good.
Can I say something? You look absolutely brilliant, Doctor, for what you...
Thank you.
Because the last time I seen you wasn't looking very...
Right. I don't remember when we last met.
Oh, a few years.
Right.
5 years, is it?
Okay, I think that was just before I was
Yes.
having my treatment, yeah.
Yes.
GPs are people too, and can have health experiences, and I have personally been through a sort of cancer journey like a lot of patients have.
See you.
And you, miss. Look after.
And you. Bye now.
Bye.
As he left, when he said, "You look really different now." I've had 2 or 3 patients because I obviously lost all my hair, so...
Oh, so they're used to seeing you with longer hair, are they? Are you feeling better? Is your
I'm
treatment
absolutely
all-
fine,
yeah.
I'm fine.
Yeah. How long ago was it?
5 years ago. Life-changing experiences, you know, whether it be through ill health or an event that's happened to you, does change you. There's no doubt about that. The thing that I took from that experience was a newer and fresher understanding of what my patients were experiencing when they went through those treatments.
Especially when you're a doctor and
Yes,
you can, you know,
exactly.
really relate to your patients, can't you? with
Oh
that?
yeah, it gives you a totally different perspective.
Sorry you had to go through it.
To be honest, I'm not sorry at all because I learned a lot through the whole process.
Okay.
Yeah, and also I also learned that our patients are really lovely. You know, the letters they wrote to me were just inspiring.
Oh,
yeah, yeah.
That makes you realise how valued you are,
Yeah,
which
exactly.
is probably what you need
Yes.
at that time, isn't
yeah,
it?
absolutely.
What's on for the rest of the day?
Well, I'm going to fetch me shopping after this, you know, like, and then go home.
Lovely.
Yeah, we don't do a lot, you know, now.
Well, it's a nice rainy day. It's a nice day to do not
Yeah, you
much.
can't get out, you know, in the garden and that, you know, like. I've got a cooking apple tree and an eating apple tree. I've got damson tree.
Cooking apples and eating apples.
Yes.
What's the difference?
Well, cooking are quite big and they, like, sharp. You couldn't eat them. They're for cooking for apple pies, you know.
Okay.
And then the other one is for eating.
Hello. Hello.
Hello.
I'm Dr. Whelan's. Come on in.
Okay.
Come on in and take a seat.
Telling him my history.
I could hear you talking about your apples, and I've got an apple tree at home, and I don't know what to do with all the apples. I thought I could give them to you. Are you here to talk about your chest X-ray results?
Yes, yes.
I don't think it was me that sent you for the chest X-ray, so do you want to just tell me why did we do the chest X-ray in the first place?
Well, I had this cough. I had a cough. And I had a terrible sore throat.
Okay. And how long have you been coughing altogether?
Months, I should think.
Any problems with your breathing at all?
Perhaps I come more upstairs and I'm a bit, you know. But
has it been like that for a number of years?
yeah, yes, I suppose so.
It hasn't just been recently getting worse?
No, not really, no.
Have you lost any weight at all?
Not really, no. Put on, actually.
In this case, that's a good sign, so that's
Is
all
it?
right.
No.
Coughing up any blood?
No.
So I've got your chest X-ray. When we're looking at the lungs themselves, it doesn't show anything worrying at all. But round the back here on the right-hand side over one of your ribs, there's just a small shadow. Now, on the X-ray, we can't see exactly what that is. Have you noticed a lump round here?
Not really, no. I don't think I'm worried about anything, you know.
Good. That's good to hear. What I think I should do is have a listen to your chest, and then I just want to have a little look round here and see if there's any lumps to feel.
Yeah.
And then we'll decide what to do next.
Okay.
Does that sound okay? So I'll start off by just coming around and having a listen to your chest, if that's all right.
Where do you want me to go, this?
Yeah, we'll go at the back of your top, if that's all right. And you were a smoker in the past, were you?
No. Never
smoked.
And
right.
Drink, don't
just
drink.
do me some deep breaths through your mouth. And down. Lovely. Now, where this lump is on the X-ray is just round here, so I'm just going to lift your top up and have a press around you. But you haven't noticed any lumps or bumps or anything?
Not really, no. More further round the front, I used to ache a bit.
So that's all nice and normal. So I think because we've found this shadow over one of your ribs on the X-ray, I think we should get a scan of your chest just to make sure we're not missing anything. It looks like there might be a little lump or something there, but it's just for us to have a closer look and see exactly what we think that is. So I'll arrange that for you.
Will you? Right.
Obviously, when there's shadows in the chest, we can be a little bit worried about it. So I'm going to ask for that to be done urgently within the next 2 weeks.
Okay.
All right, any questions?
Not really, no, that's it, you know, like I think, you know. Thank you for seeing me anyway.
No problem. Nice to meet you, but you must let us know if any problems, okay?
Okay, yes, thank you.
Right.
Right, bye-bye.
Bye now.
Bye-bye.
Thanks, Iris. Enjoy your afternoon.
Surgery.
You been at work or are you resting?
No, I'm actually a dual citizen, so I'm from Canada and here, but my family lives here.
Right.
So I'm just visiting right now.
Oh, cool.
Yeah, my grandparents were from here, so I've been here since I was little.
Cool. So Birmingham feels like home now.
It does,
after
yeah.
years.
No, totally, yeah.
Oh, that's good.
Yeah.
Hello.
Thanks.
It's Dr. Hyder. Come through and have a seat.
Hello. Nice to meet you.
And how can I help you today?
Okay, so I'm from Canada.
Yeah.
And I have a prescription for hydromorphine because I think I'm gonna end up having something done to my knee.
Right.
But it's a Canadian prescription.
Okay.
So then they've given me a month here, but the pharmacy just dispensed a week.
So tell me, when did all the knee problems start and what's happening with it?
That was from the gym, just from lifting, and I don't really know what I've done. They said something to do with my ACL maybe or something. I don't know. So I think Canada's a little different than here.
It is a bit.
Yeah, but
yes.
over there they give out morphine and stuff a lot easier than here.
Yeah.
So
The concerns with Sean were that he was being prescribed morphine in a different country and we didn't have his full medical records. He was also on quite high doses of morphine for knee pain, which we wouldn't usually see in general practice in the UK. Did you have any other medication that you were taking in addition to the morphine? Or?
I'm regularly on Zopiclone for sleep.
Yeah.
I'm on testosterone replacement therapy and growth hormone.
Okay, all right. And what medical conditions are they for?
Those are not, I don't think they're for medical conditions, they're just for the gym.
Okay.
But the doctors give them to me.
Right, okay.
Yeah.
All
So
right.
again, I think the
It
Canadian
is a bit
system's a little different.
Yeah. For the knee pain, do you take any anti-inflammatory medication or any paracetamol?
I've taken Advil, which I think is your equivalent of ibuprofen.
Okay, so you take that as well, and then the morphine.
Yeah, the morphine is just twice, 2 times a day.
Yeah.
It's gone up a bit, so,
Yeah.
because it just stopped working.
It stopped working.
Yeah.
So has it gradually been increased over months or years?
Not years, just a couple months.
When prescribing pain relief for patients, we usually refer to a ladder of treatment. And at the bottom of the ladder, we start with paracetamol and anti-inflammatories, and then this works its way up until we get to morphine at the top. When you're on something as strong as morphine, we need to be quite careful because it has addictive properties. I mean, the worrying thing is if you're needing to increase the medication so rapidly because it's not helping with the pain, you may also be becoming dependent on that medication.
I'm pretty sure that's already happened.
So hydromorphone, because it's a drug of dependence, and it's quite a high dose.
Yeah.
We need to really get the authorization from the drug doctor that works here. So let me put it through to her, and then we'll try and move things forward quickly for you.
Thank you.
All right.
Great.
Anything else you wanted to ask me today?
Nope.
No. Okay.
That was it.
Let me get in contact with her then.
Okay,
All
thank you
right.
so much.
Take care. Bye bye.
Thank you.
Thank you very much.
Have a nice day.
You too. Bye.
My feet were like, not massive, but really swollen. Yeah, couldn't get my shoes on. Whilst I was on holiday, I was doing a lot of walking.
Yeah.
And all of my shoes cause pressure on this area here.
Okay. Normally with your footwear, are you quite good at wearing quite good shoes?
What shoes do you wear for work?
Steel toe caps.
Right, so that doesn't help, no.
The other useful thing is to make sure that you wear good footwear.
And footwear as well. Flat shoes don't help.
Not footwear that's hard or abrasive or something that rubs on this, because that will make it worse.
Hiya, good morning, come on in. Come on in, take a seat. My name is Dr. Rafi. Thank you for waiting for me.
No, no problem.
How can we help this morning?
I got diagnosed with diabetes around about 12 months ago this December.
Okay.
And I've had pain in my feet, and I know it's something like that, but my left foot, I've got a constant pain in the centre, and it gets really bad.
Okay.
And sometimes I can hardly walk on it. Okay. But then it does disappear for a few hours, but then it comes back. I've tried different trainers. I've been to a chiropodist.
Oh, yeah?
He sold me some insoles.
Yes.
But they don't seem to work.
Okay. Can you think of when it started off?
It started off before I got diagnosed with diabetes.
Okay.
So it's been about 18 months, probably 2 years.
All right, Jim. At the moment, would you say that's daily pain?
Yeah, daily.
Every day?
Yeah.
Okay. What makes it worse? Have you noticed anything in particular making it worse?
Standing on it all the time, I presume, yeah.
Okay.
Yeah.
And then when you're off your feet, so, relaxing in the evening, lying down in bed, does that ease the pain?
Not really, because I can, as you curl your toes, they'll make a pain in the centre. Yeah. And then if I stretch it, it will make the pain again still. Yeah.
So, I mean, one of the things that you mentioned already was your diabetes.
Yeah.
And I'm sure people won't stop telling you about looking after your feet when you're diabetic.
Yeah.
So, I'm glad you picked up on that. Yeah. And do you mind if I get you up under the couch? Right, so, as is always, you tell the doctor where it hurts and that's where they prod.
Yeah, yeah.
So, pre-warning, it'll probably hurt if I get the right spot, all right? And I'll just need to compare between the 2 feet as well.
Yeah.
Okie dokie. Right, so let's start off with the problem side then. Just let me know if I get to the right place, okay?
Yeah, round about there.
Round in there? Yeah.
Yeah. And there as well.
And there as well. All righty.
Yeah, the top's fine. It's usually in the ball.
Yeah.
No, that side's absolutely fine.
Okay.
Yeah.
When did you go to see the chiropodist?
I'd say over 7 months ago.
All righty, come and take a seat. Yeah, I mean, what you've got, or what it indicates that you've got on examination is pretty common, actually, especially for people who are on their feet a lot. It's something called plantar fasciitis.
Okay.
Have you come across that before?
No, never.
All righty. Okay, so...
Sounds like something out gardening.
So, do you mind if I show you a little picture?
No, it's fine.
Because it's easier to explain it then. You can see where you're getting the pain. is pretty much that spot that it indicates on there. Yeah, so it's where the heel comes down towards the arch, but the plantar fascia runs all the way from front to back.
Okay.
Alright, and it's just like a cushion, like a padding.
Like an insole as such.
Almost, yeah. So, you know, and it's made of pretty tough material because actually, you know, you're on your feet all the time and it needs to be made of pretty tough material. And there's lots of little things that we can do about it, and most of the stuff is what you do, rather than what we're going to be doing. What you've got on now, especially for hard floors, your thin flip-flops, is going to irritate that plantar fascia more. The mainstay in terms of medication is using anti-inflammatories. Naproxen is stronger than ibuprofen, and something that we can prescribe you. So don't take both at the same time.
No.
Take one or the other.
Yeah.
Any questions?
No. I just wanted to make sure going down the road that he wasn't connected to the diabetes.
No. And so the main foot pain that we worry about with diabetes is nerve-related pain. It's called neuropathy.
Yeah.
And that shows that the nerves are being irritated. Whereas what you're describing at the moment is very much the plantar fasciitis.
That's fantastic.
Yeah? So
I say fantastic. It's still
at least you know.
At least I know. Yeah.
At least you know. All right, team.
That's
Any questions?
No, that's it.
All righty. Nice to meet you, sir.
Thank you very much.
Take care of yourself.
Thank you. Cheers.
Bye.
Cheers. Thank you. Ta-da.
Lovely. Thank you so much.
That's all right.
Really
Take care then.
Thank you. Bye-bye.
Does that
Thank
sound
you very
all
much.
right?
Yeah.
Great. Lovely.
Cheers.
Nice
Thank
to see you.
You too, bye.
Bye.
All right.
Yeah, thanks very much.
Take care, sir. All
Cheers,
the best.
thank you.
Bye-bye.
Bye.
Right, lovely. Thank you very much indeed.
You're welcome.
Okay. Bye then. Bye.
Thank you. Bye.
I've lived in Birmingham for about 30 years now, and what I like is the warmth of people from Birmingham. They treat you as their doctor, the person that they can connect with, who they know is their safe person that they can go to at times of need. For me, the best part of the job is seeing patients and having that conversation with them. Not always just about their health, but things going on in their lives, and forming that picture of what's happening to them is what makes it special.
Do you think it's cancer?
It might be that it isn't cancer at all.
You ready?
Oh.
Hold on.
Oh, that...
Whoa. You're not putting that in my ear. All I think about my ears.
Okay, where can we put it?
What other holes do you use?